is going to enact a lot of new fees.
Yeah.
Or taxes, depending which way you want to look at
Right.
it. It's still more money. It's going to cost every American more money. In fact, it mandates that every American pay somewhere around $2,500, depending on your income, every year for health care. And it has many other fees and costs to businesses.
Right.
And there's a lot of debate on how this is going to function, can it be done, and is it going to improve the quality of care, is it going to have other features we're not expecting that are going to be negative, that we've seen in countries like England, Canada, have encountered already. Looking at that from the business side, again, we're trying to cut down time. But what do you see about that? What did you think of it? Would you have voted for it?
No, I wouldn't have. When we entered into debate, I think the two things were coverage and cost.
Yes.
We want more Americans to have coverage, and we're concerned about rising health care costs. What are my three major concerns about the bill? One, as you'd mentioned, forcing people to buy insurance. And the penalties, the fees going on in there, I just don't think they're going to work. I think some business owners I'm talking to are saying, hey, I'm just going to take the fines, the penalties, and I think you're just dealing with a lot of bureaucracy here. Thousands and thousands of new IRS agents to collect the taxes from it and to navigate this system. So I don't think it's going to achieve, getting the universal coverage that they're talking about. And there's some constitutional issues to forcing people buying a product. So that's issue number one. Two, the taxes and fees. The Wall Street Journal and MSNBC almost simultaneously reported, if you look at the number of taxes and fees, taxes on small businesses, those doing $200,000 and more, and fees on tanning salons and taxes, on wheelchairs, on medical device manufacturers, it's the largest cumulative tax increase in our nation's history at the exact wrong time when you look at where this economy is going. So that's concern number two. Concern number three is our seniors. Seniors have paid into Medicare and Social Security. There's a $500 billion Medicare cut in this year. And a lot of seniors are relying on this Medicare Advantage program here in our state. So I think that's the wrong decision. Those are my three primary concerns with the bill. What could have we done with cost and coverage? And this is what frustrates me to no avail. I think so many good ideas came up during this debate, but we got the final product was something that didn't address these concerns enough. One, with coverage, you hear numbers thrown out of tens of millions of uninsured Americans. If we break it down into three parts, it is those working for small businesses that can't afford insurance and small business owners. It is some people who could qualify for Medicaid who aren't right now. If you go on, we have obviously another huge issue, illegal immigration, but a large number of those who don't have health insurance are illegal immigrants, which really both sides have said. Democrats have said, oh, we don't want illegal immigrants to have government health care. Republicans and some are saying, hey, we don't have enforcement mechanisms enough in here. But how can we get, I think the primary thrust should be then, how can we get those who can't afford insurance to be able to afford it? Let's not do the penalties. Let's do tax credits, incentives, other things to buy insurance. And I know the bill has some of those, but it has penalties with the tax credits in there. Let's do a free market tax credit approach. And then, you look at one of the biggest problems with coverage is a lack of primary care. Can we look at getting more people to buy into insurance through incentives? Can we look at more primary care options? I think that would address coverage. In terms of costs, very frustrating. Look at the costs, how they're rising for the average American, for the average business, and look at car insurance. You can purchase car insurance down the road, like I am here. You could go on the internet. You can get car insurance from anywhere. You could go with Geico, their goofy commercials there. Health insurance. Why, with most of us, with our employer, are they saying, my employer says, here's your health insurance, here's plan A and plan B, and that's it. And the insurance situation opened up, so we had more choice across state lines, types of plans. so-called Cadillac plans and others, that would have lowered cost, I think. And then another issue, look, when you're going to a doctor, when you're having surgery, when you're having prescriptions, you're really putting your trust in them. We have a vigorous training for our physicians. Do they make mistakes sometimes? Sure. Should they be held liable? Sure. But our medical malpractice, insurance costs, and lawsuits out of control? Absolutely. And that was something that wasn't addressed effectively. Other things that when people are saying repeal and replace, sure, I want to see this health care bill. I don't think it was a good bill, but
right.
What's going to happen? We're going to have a Congress
right.
that's dealing with President Obama. He's not going to just scrap his bill that he had. So we got to say, hey, how can we improve upon it? Here, what are things we can agree on? And I think come forth with new ideas here. Well, the other ones are sorted out, and I think as we go through, there are going to be huge concerns, as I mentioned, from the three areas. One, forcing us to buy insurance. Two, the taxes and fees, and then three, the seniors, the cuts that they're facing.
Okay. Up again in the health care bill. For it, against it?
Yeah. Background, my wife's from Colombia,
right.
South America. Background, my wife's from Colombia,
right.
South America. We met, her English wasn't too good, my Spanish wasn't too good. It was quite a romance, but we fell in love and things worked out for us. We've gone through immigration the right way here. All the paperwork, all the fees, it's very expensive. We've had family members that have wanted to come and visit, and they can't because so many people come and stay illegally. And that's a huge concern for the U.S. government.
Right.
So, from a personal perspective, I see the problem with illegal immigration. People who want to do it the right way, which all of us are descendant from immigrants one way or another, right? People who want to do it the right way can't because of the current situation. So that's one concern. Second, you've got just this massive problem. It can't be a good thing for 10 to 20 million people to be living here illegally in the shadows, and something has to be done. I think for immigration we need a clear system of supply and demand. If there's jobs no Americans would take at a reasonable wage, then there should be visas provided for them, and we have some. But I think when you're looking at this situation and the illegal immigration in California, Arizona, and other states, you're looking at maybe there is a supply for those farm jobs, those agri jobs. It's hard to make the case that there's many jobs available when we have 10% unemployment. But let's have a fair system
right.
where, okay, we've got visas available. I think we need to go after the corporate types there, these corporate farmers that are doing the illegal hiring. That's probably the easiest way to root out the system and say, hey, show us your books. Are your people here working legally? And I think that's what needs to be done. That's going to be your most effective way to get this problem. But securing the border is incredibly important as well. And when you look at Arizona, my reading of the law is it mirrors federal law. If you look at the Constitution, it gives the federal government the responsibility to do immigration law, but it doesn't say states can't make their own laws to help out with problems. And Arizona is dealing with the situation now, not just of illegal immigration and the problems with that, but of all that drug violence on the Mexican border that's spilling over into Arizona. So we're looking at major security issues here, and I support Arizona because the federal government has just let them down and let us down, really.
I thank you very much.
Yeah, no, thank you for your time. Yeah, sure.
Thank you for your time. And I'd like to do this again. Before the election, if we can, or afterwards, especially if you win. And go over this a little bit more. And go over this a little bit more. There's a lot of things you said that deserve more time.
Sure, yeah, right.
More time.
Sure, yeah.
And hopefully we'll get a chance to speak before this
time here. Yeah, I mean, what I'd say in closing is if you've had enough with the mess in Washington, if you've had enough with career politicians, out of control spending, the economic situation, give us a chance here. What do we have to lose? Give us a chance. If you've had enough, join our cause. We're at electgeorgephillips.com, and I think you can do a great job down there. I'm not looking to be a career politician. I support term limits.